As we age, our skin naturally changes. These changes can include a loss of elasticity, the appearance of wrinkles, and a general thinning of the skin. This makes it more susceptible to damage from external factors such as the sun. It's important to take extra care, especially as we welcome the warm embrace of summer. The sun's rays, while warm and inviting, can be particularly harsh on aging skin. Applying sunscreen with a high SPF, wearing protective clothing, and seeking shade during peak sun hours are all essential steps. While enjoying the sunshine is wonderful, we need to be mindful of its effects on our skin. Prolonged exposure to UV rays can lead to sunburn, premature aging, and even skin cancer. It's crucial to balance our time in the sun with protective measures to ensure our skin remains healthy and vibrant. One concern that often arises for seniors is basal cell carcinoma, or BCC. This type of skin cancer is primarily caused by long-term exposure to UV radiation from the sun. It often appears as a small shiny bump or a red patch on areas of the skin that are frequently exposed to the sun. Don't worry though. Understanding BCC is the first step in protecting yourself. By being aware of the signs and symptoms, you can catch it early and seek treatment promptly. Regular skin checks, both at home and with a dermatologist, are key to early detection. BCC is the most common type of skin cancer, and the good news is that it's highly treatable, especially when caught early. Treatment options include surgical removal, topical medications, and in some cases, radiation therapy. Your healthcare provider can help determine the best course of action based on the specific characteristics of the carcinoma. This essay will guide you through everything you need to know about BCC, from recognizing its signs to effective prevention strategies. We'll cover how to perform self-examinations, what to look for, and when to seek professional advice. Additionally, we'll discuss lifestyle changes and protective measures that can help reduce your risk. Remember, knowledge is power when it comes to our health. By staying informed and proactive, you can enjoy the summer sun safely and keep your skin looking and feeling its best. So let's dive in and learn more about how to protect our skin and maintain our overall well-being. Basal cell carcinoma is a type of skin cancer that originates in the basal cells. These cells are found in the deepest layer of our skin, the epidermis. They are responsible for producing new skin cells as old ones die off. Sometimes these basal cells grow abnormally and uncontrollably, leading to BCC. Think of it like a small group of cells that have forgotten how to behave. BCC typically grows slowly and rarely spreads to other parts of the body. Recognizing the early signs of BCC, or basal cell carcinoma, is crucial for early intervention and treatment. Keep an eye out for any unusual spots or growths on your skin, as these could be early indicators of BCC. Pay special attention to areas frequently exposed to the sun, like the face, which is often the first place where signs of BCC appear. Other common areas include the ears, neck, and scalp, as these regions are also regularly exposed to harmful UV rays. Don't forget to check your shoulders and back, especially if you spend a lot of time outdoors without adequate sun protection. BCC can manifest in various forms, making it essential to be aware of the different ways it can present itself on your skin. One common form is a pearly or waxy bump, which often has visible blood vessels running through it, giving it a distinctive appearance. Sometimes BCC can look like a flat, flesh-colored or brown scar-like lesion, which can be easily overlooked if not closely monitored. Other times, it may present as a sore that bleeds or scabs, heals, and then returns, which is a clear sign that something is not right. If you notice any persistent changes in your skin, such as new growths, sores that don't heal, or changes in existing moles, don't hesitate to consult a dermatologist. Early detection and treatment are key to managing BCC effectively. Dermatologists have the expertise and tools to accurately diagnose and treat BCC, ensuring the best possible outcome for your skin health. Remember, prevention is also crucial. Regularly applying sunscreen, wearing protective clothing, and avoiding excessive sun exposure can significantly reduce your risk of developing BCC. By staying vigilant and taking proactive steps, you can enjoy the outdoors while keeping your skin healthy and protected. Why me? Causes and risk factors. While the exact cause of BCC remains unknown, one factor plays a significant role: ultraviolet radiation from the sun or tanning beds. Overexposure to UV radiation damages our skin cells' DNA, increasing the risk of developing BCC. Fair-skinned individuals are more susceptible to BCC, as are those who have experienced frequent sunburns, especially during childhood. Having a family history of skin cancer also increases your risk. Additionally, certain medical conditions and medications can weaken the immune system, making individuals more vulnerable. Diagnosis and treatment. You've got options. When it comes to managing your health, especially concerning skin conditions like basal cell carcinoma, BCC, it's crucial to understand that you have multiple options available. This section will guide you through the various steps and choices you have in diagnosing and treating BCC. If you notice any suspicious spots on your skin, your doctor will conduct a thorough physical examination. This initial step is vital in identifying any potential issues early on. Early detection can significantly improve the effectiveness of treatment. They may use a dermatoscope, a special magnifying tool, to get a closer look. This device allows the doctor to examine the skin in greater detail, helping to identify any abnormalities that might not be visible to the naked eye. To confirm the diagnosis, a small sample of the affected skin or biopsy will be taken and examined under a microscope. This step is crucial as it provides a definitive diagnosis, allowing the doctor to determine the exact nature of the skin condition. Treatment for BCC depends on several factors, including the size, location, and type of BCC, as well as your overall health. Common treatment options include surgical excision, where the cancerous tissue is surgically removed. This method is often used for larger or more aggressive BCCs and aims to remove all cancer cells to prevent recurrence. Mohs surgery, a precise surgical technique that removes thin layers of skin until no cancer cells remain. This method is particularly effective for BCCs located in sensitive areas, such as the face, as it minimizes the removal of healthy tissue. Cryotherapy, where the tumor is frozen and destroyed using liquid nitrogen. This treatment is often used for smaller, superficial BCCs and is a quick, non-invasive option. Topical chemotherapy, where anti-cancer creams are applied directly to the affected area. This method is suitable for superficial BCCs and can be done at home under medical supervision, making it a convenient option for many patients. and radiation therapy, which uses high-energy rays to kill cancer cells. This option is often reserved for cases where surgery is not feasible or for patients who prefer a non-surgical approach. Radiation therapy can be highly effective, especially for BCCs in difficult-to-treat areas. Remember, the choice of treatment will depend on your specific situation, and it's essential to discuss all available options with your healthcare provider to determine the best course of action for you. Your doctor will consider various factors, including the type and stage of BCC, your overall health, and your personal preferences to recommend the most appropriate treatment plan. By understanding your options, you can make informed decisions and take an active role in your healthcare journey. Looking ahead, prognosis and recurrence. The good news is that BCC has a very high cure rate, especially when detected and treated early. However, it's essential to remain vigilant, as BCC can sometimes return or recur. Regular follow-up appointments with your dermatologist are crucial to monitor your skin and catch any potential recurrences early on. Remember, early detection is key. If you notice any changes in your skin, don't hesitate to schedule an appointment with your doctor. Understanding BCC is the first step in protecting yourself. By being aware of the signs and symptoms, you can catch it early and seek treatment promptly. Remember, knowledge is power when it comes to our health. By staying informed and proactive, you can enjoy the summer sun safely and keep your skin looking and feeling its best.